The Mike Hosking Breakfast, 6 to 9 weekdays on Newstalk ZB.
G'day there. We end the week with a bit of good health news. We've been weighed down this week, haven't we, with the scrap over 14 layers-ish of management, no doctors in Dargaville at certain times of the day, a new CEO and 4 regional operations that allegedly will sort the health mess out, former board members snapping back at criticism from the Prime Minister, a myopic media trying their best to out Shane Retty in what may or may not, most likely the latter, be some sort of semi-scandal around his interpretation of the need to sack boards. But the good news, the removal, the cancellation of the Ethnic Diversity Equity Adjuster. Oh, you remember that one. It was a massive scrap under the last government who tried desperately to explain that using race was a good way to work out who to put at the front of the non-urgent surgery line. 5 indicators we used, things like age and location, but race was the one that got most of us upset, given we thought we lived in a fair and open country where race was not an issue when it comes to publicly funded services like health. It was predicated on the idea that Maori are not well served by health, and in some respects that is true, of course, but poor old Chris Hipkins, you might remember, got himself woefully tied up in knots over an example of a person who lived rurally, many of them Maori, and how because you were rural, you didn't have access or the same access to doctors as you might in a city, which of course is also true. But then neither do you if you live rurally but aren't Maori. That particular piece of logic seemed to elude him. And when faced with the example of the 2 people with the same conditions and the same need fronting, except one was Maori and one wasn't, why it was fair race then made the difference, they couldn't quite offer an explanation that made any sense. Ironically, some in the health service who reviewed this defended it, but people also seem to be able to defend Maori seats, Maori wards, Maori funding, service and entitlements that are purely race-based. No wonder they're so angsty about David Seymour's treaty bill when the scales are tipped that far your way. An injection of balance and fairness and open democracy might be a bit worrying. So, in health, the Race Equity Adjuster is going. A reason, if not to celebrate, at least to be relieved about.
The Mike Hosking Breakfast, 6 to 9 weekdays on Newstalk ZB.